Well, hello. I'm Pandi of Pandi's Hair Candy and More. If this is your first time stopping by my channel, welcome. If you are a returning subscriber, welcome back. This segment is called My Medicine Cabinet. These are my chronicles as a pharmacy technician. Most of you all may not know, but in my professional world, I am a certified pharmacy technician. I am both nationally as well as state certified as a pharmacy technician. I actually work in a hospital pharmacy setting. So in this segment, My Medicine Cabinet, I chronicle tidbits of information to share with you to help you live a better, healthy, and more prosperous and productive life. I share information that will help you. So with that being said, I want to thank you for taking a moment to click on this video, come over and check me out, see what's going on over here in Pandi's Medicine Cabinet. Now, without further ado, I'm going to jump right in to this little bit of information that I'd love to share with you all, and I hope that it blesses you in some type of way. Now, as the nation is reckoning with racism, medical communities are taking action to address the health disparities among minorities by declaring racism as a public health crisis. Now, while racism impacts all people of color, Black Americans have historically been among the most impacted. So I'm going to kind of just take a few moments to look at some of the connections between race, racism, and health in the United States, and discuss a little bit of the actions toward health equity to all. Now, what is racism? While it might seem obvious that the definition of racism has evolved, it doesn't just refer to hate groups or bigoted comments. Racism is actually folded into the foundation of our country. So much so that racism may go unseen to some who don't experience it. Racism can be direct or indirect and affects Black people and other minorities of all classes, ages, and genders. Now, how is racism linked to public health, you ask? Our race actually impacts our health outcomes, similar to other social determinants of health, such as housing, education, and work situations. Black Americans report higher overall stress levels compared to white Americans, and chronic sustained stress over time can raise the risk for conditions such as heart disease, high blood pressure, and depression. And lack of adequate health insurance coverage remains a major barrier to accessing quality health care for people of color and low-income individuals. Research shows the American Academy of Pediatrics, the American Medical Association, and American College of Physicians, among many other health institutions, have spoken out against the major health and socio-economic disparities among Black Americans, naming racism as a public health concern. Overall, Black Americans are living longer, but in certain regions of the country, this isn't the case. For example, in Chicago, in the predominantly white and affluent neighborhood Streeterville, residents are expected to live until about 90. While in the predominantly Black and poor area of Inglewood, only 9 miles away on the city's south side, residents typically live until about age 60, according to a study by NYU School of Medicine. The life expectancy for Blacks living in other cities is shorter including Los Angeles County, New York City, and Washington, D.C. Black Americans are also more likely to have chronic health conditions according to the Centers for Disease Control. Younger Black Americans are living with diseases more associated with older age groups, including high blood pressure, diabetes, and stroke. This current COVID-19 pandemic has made race disparities and the systematic racism that they are rooted in more apparent. Severe illness and death rates have historically been higher for racial and ethnic minority groups during public health emergencies. And to address the needs of these populations in emergencies, the CDC stresses improving their daily life and harnessing their strengths. Now, what are some of the factors of these health disparities? There are various factors and social inequities. There are various of them. A lot of these have put members of racial and ethnic minority groups at increased health risk, and all of these are factors that affect our health, and all are shaped in some form of systemic racism. So it's a little bit different. It's not like a hatred type of racism, but it's a systemic thing. We are not quite sure why Black Americans and other ethnic groups are being affected at much higher rates than those of our counterparts. But I mean, we see this every day if you are following the news trends. Now, Black people are also more likely than white people to report not being able to see a doctor in the past year because of cost, living in areas without clean water or air, having less access to green spaces, growing up in high poverty areas, and being exposed to greater occupational hazards, often working in frontline jobs across many fields. The question posed is, what can be done? The first step is identifying this type of racism in a health crisis. Then comes a plan of action for addressing it. Now, the CDC recommends these actions for public health care providers, which I fall into the category of. Ensure healthcare professionals understand cultural differences and the social and economic conditions that may put some patients at higher risk than others. Link more people to accessible doctors, nurses, or community health centers to encourage regular and follow-up medical visits. Support actions to create healthy food environments and increase physical activity in underserved communities. Now, what can you do? By discussing actions of racism with your friends, co-workers, and family, you are more likely to affect change in your communities. Address racist attitudes and statements when you hear them. If you have the means, contribute to community organizations. And lastly, volunteer at organizations to help minorities gain better access to care. To ensure that everyone has an opportunity to be as healthy as possible, it's important for us to bridge access to care. Pharmacies, pharmacists, and pharmacy staff are often the most accessible and frequently visited members of the healthcare team, especially in underserved areas. We can help with finding affordable prescription drug coverage if you've lost your insurance due to the COVID-19 situation. You can always reach out to your local pharmacy staff. Worst possible case scenario, if it's a question presented that we can't answer, we can probably more than likely point you in the right direction to someone who can better assist. I want to thank you all for taking a moment to click on this video. I am Pandi of Pandi's Hair Candy and More. Thank you so much for joining me for my medicine cabinet, my chronicles as a pharmacy technician. If you didn't remember to do so on your way in, I would greatly appreciate it if you wouldn't mind thumbsing up the video. It greatly helps out with my analytics. And if you've enjoyed this segment, please take a moment to subscribe. It is free $99. It doesn't cost you anything. I'm Pandi of Pandi's Hair Candy and More. Thank you so much for watching, and you have a wonderful, wonderful day. Bye.